So we all know what a healthcare-associated infection is, and I'm not going to give you that lecture. We'll hear lots of details as we go through the next couple of days. But I think we can agree that it's time to do something different and to think outside that box.
This man's name is Jerome Lace. Jerome recently published a brilliant viewpoint piece in BMJ Quality and Safety. In that viewpoint, he raises the great boogeyman of continuous improvement cycles. How sustainable are they? We've supported normal practices, but we haven't addressed the system drivers. We haven't rebuilt the silos, we've just propped them up.
95% compliance. When you see those, don't believe them. They're almost always artificially high.
But we are naive, and we have been naive, all of us, myself clearly, for years, thinking that guidelines would work, techniques would work. Nothing works without the whole shebang.
So it's not just about the data, it's not just about the technology, but how do you approach it in a holistic way to make sure it becomes part of the culture on a sustainable way.
We're human. And as humans, we hate to change at times. And if that doesn't become daily work, if that doesn't become embedded within that organization, within the culture, you're not going to sustain it. They have to be part of the solution. If they're not part of the solution, I can almost guarantee you're going to have failure because they're not going to accept it.
Low-touch surfaces, we're getting a strong feeling they're almost as important, if not as important, as high-touch areas, and I think it's an area that needs more investigation.
How clean do we need to be, recognizing our environment will never be sterile, but how clean does it need to be to protect the patient, to reduce infection transmission to a level that is acceptable?
There's a big difference between cleaning and disinfection. Try to find a technology that's 50 years old in that hospital, and you'll usually find it in the housekeeping department. Housekeepers, and I can tell you personally from experience, they're visually cleaning. You need to be an Olympic athlete to try to clean 22 rooms a day. It's not physically possible.
And what does that clean mean? What's that definition? We still don't have that.
Hand hygiene is a process measure. It's not an outcome measure, but there's a huge amount of attention paid to it. And really, environment cleaning should really be seen along the similar way. It's also a process measure that leads to bad outcomes.
Usually there's this magic hand waving that goes, environmental data is messy. It's just, that's what it is. That's not good enough when we're talking about it from a health risk assessment standpoint. We need to be smarter with how we use the data. Instead of saying everything's zero just because I didn't see it, you need to take into account your detection limits. QMRA is very useful and very good at building out simulations to target what data to get, in what way, in what numbers.
I've really enjoyed coming here and working with many of you over the last, what is going to be 2 days, because it is the type of multidisciplinary approach that we need in order for this type of strategy to work.
Life safety and building codes involves fire. That's it. Does the building stand? That's it. Water system, not protected. CDC does not mention stagnation, and other people don't mention it as big of a problem, but we're really over-conserving, and we need to run this water as part of its safety.
Likewise, those pressure relationships are essential to infection prevention. We say that pressure is infection prevention because if you can manage it, you can control the aerosols.
My take home from this meeting is we want dynamic movement of air and water.
What if we start having interventions where we understand our clinical microbiome and then we can seed back beneficial organisms that protect that environment and never let the bad guys become a player?
Do we think about the best practice, not just the minimum standards?
This is a consensus group in a lot of things that we're wanting to do. And if we want to move things forward from activities like this, then we can think about doing that in a consensus way, because that's what's something that CMS recognizes as being a minimal standard of practice then.